New analysis from the Kaiser Family Foundation shows an average of 20% of medical claims were denied in 2023. Researchers looked at plans available through healthcare.gov. Scott Speranza is the CEO of HealthLock, a group that helps consumers fight medical billing errors. Good morning, Scott. Thank you so much for joining us.
Hey, Jenny, thanks for having me.
Absolutely. Scott, the analysis also shows that Texas has one of the highest average denial rates for in-network claims by healthcare.gov insurers. Why is that?
Well, you're absolutely right. So the national average is about 17%. And remember, we're talking about in-network claims, not out-of-network claims. Texas is 22%. It's significant. And again, an in-network claim should be a procedure that is covered by your insurance. Everything may have been pre-approved. And so something happened in that. And it's complicated. And medical necessity, those really aren't thankfully, the most reasons why it's denied. It's an other category. That other could be administrative. It could be their services were excluded. You had a limit reached. But it is definitely an issue, and it's 30% on average with the ACA in general. Those are out-of-network and in-network claims. 20% if you have an employer insurance, and even 12% for Medicare and Medicaid.
Making appeals, the appeals process, pretty important. So what should consumers do and not do when appealing that denial?
Well, the first thing is appeal. So, unbelievably, only 1% of claims are actually appealed, and then 2 of 3 folks lose their appeals. So the first thing is appeal. The second thing is make sure that you are getting as much visibility and communication with your provider and your insurance company. The reason a claim is denied could have been the carrier that is saying that this isn't covered. It could also be that the provider hasn't produced the right information in the process of what they call claim adjudication. And so something needs to be added to it. That's the administrative issue. Or again, what you've seen in the news is that it could just be a denial that's common. It could be even, of course, AI driven. There could be some nefariousness behind that. And so you've got to go ahead and pay attention to those things. And 1, submit. 2, look at what the codes say, the pricing says, and any information you can. And 3, always be working with both your provider and your carrier.
So it's important to keep all your documents, right, Scott? So how successful are appeals these days?
Well, again, 2 out of 3 folks lose. You're talking about potentially, there's 40 million claims that are denied just within the ACA public market. The data is hard to find, but we believe it's somewhere over 100 million claims are denied. 66% of bankruptcies are still due to medical bills. You've got 53% of credit issues are medical. Third of all debt is medical related. So this is a big issue. And, the hard part is that insurance, which creates the ability to get the best care, also has the complexities. And so just like we use an accountant for taxes, what's really happening now is needing experts to navigate, especially if you've got a large claim, a hospital bill, some kind of chronic issue that just happened, unfortunately. You're going to probably need help, just like you rely on an accountant. There are do-it-yourself tools within the accounting world, certainly from a medical standpoint. If you're on it and you know the information, you have the time, the energy, the resources, you certainly can go ahead and pursue that. Probably best to try to find a professional, especially if it's a high bill.
Well, Scott Speranza with HealthLock, we appreciate your advice, and thank you so much for joining us here on KVUE News Midday.
Thanks for having me.
Sure.